Hi, my name is Dr. Fred Sylvester from Hanover Chiropractic, and welcome to this episode of Health Talk. We're kind of doing a little bit of a different spin on Health Talk. We've in the past brought other professionals in to talk about different conditions, but today we're going to do is we're going to start a series of how we can help patients do some self-improvement. And today we have one of our lead clinicians, Dr. Karen. She's been with us for 23 years, very seasoned, very experienced, also graduated from New York Chiropractic. Joined our practice in 2003. Here we are in 2025. Time flies when we're having fun, aren't we?
Yes.
So welcome, Karen. One of the things that you have, I'll say honed in on over the last 2 decades is neck pain and headaches. Multitude of people come to you for those particular conditions, and so what we want to do is just share some different things on what you're looking for, how we do some treatment, how maybe you can even influence some people on a self-help mechanism, and how we can make their quality of life a little bit better.
All right. So yes, I love treating neck pain and headaches. What I find that is so common anymore is patients' posture plays a direct role in this. Yes. So as you can see, we're sitting up nice and straight. I always tell patients your posture plays a huge role outside of our practice. But what happens is today we are such a forward society where we are on a computer looking forward, or in our phones, or reading a book, or just feeling the daily stresses of life where we're rounding forward looking down. So that being said, what happens is our head is about 11-pound bowling ball that we're holding up on top of our body. And if you think about that and you're holding a bowling ball nice and close to your body, it's a little bit easier to hold versus if you put it out here, it's going to put a lot of stress and strain up through your neck and upper back. Sure. So what we're looking at there is when the head comes forward, it puts strain through the muscles at the back of the neck.
I'll demonstrate.
Yes, please do.
So from the side, it kind of looks like this.
And so that's going to put a lot of strain in the muscles here and through the neck. And then what also happens there is when you come forward, because we're not just looking down, we have a tendency to peek up, and that's going to tighten up the muscles right at the back of the neck, which are the suboccipital muscles. Your suboccipital muscles are very small muscles that form a small triangle and encompass the suboccipital nerve. That suboccipital nerve, when it gets pinched, can create tremendous pain and headache, going from the back of the head, I want to put behind you, and around to behind the eyes. So those are one muscles that we need to look at, or one group of muscles that we need to look at, make sure that we're addressing to alleviate some of that pain.
Sure.
The other thing with the posture is going to be that trapezius muscle back here, and that muscle has a common referral pattern that comes up from your side of your neck, up around the ear, and into the temple of the head. So what I want to do is just go through some few quick exercises that you can try to use outside of this office to see if they help you, and if they don't, then maybe you come see us. So the first one that we're going to do is a chin tuck. So again, that head's out in front, and you're just going to bring it straight back in. And I always tell patients it's as if you want to give yourself a double chin. So it's not looking down, it's not looking up, it's straight back.
So it's not like this?
Correct.
Not like this, it's just a simple pushback.
Straight back, yes. Women love doing this one. It's something that's easy to do in the car against your headrest, or you can do it laying in bed into a pillow, and that way you have a little gravity assist.
For sure.
But that way, still, your eyes are staying forward to help remind you that you're not going up and you're not going down.
Gotcha.
So great demonstration of that. What you're going to do is pinch and hold that for about 2 seconds and release and repeat it 10 times.
Okay.
And it shouldn't be with great contraction, just a gentle hold.
If the pain gets worse, stop. What should you do with that?
I always tell patients not to do anything into a sharp pain.
Okay. All right.
So a gentle ache is okay, but if it's too much, then let go.
Great.
All right. The next one that we're going to do is a just general range of motion to help loosen up the neck. So I just want you looking down and up. And I always tell people slow and controlled 10 times. This is going to help just do general range of motion in the neck and loosen up some of those muscles that maybe we're not moving on a day-to-day basis because we stay in a static position, as well as going 10 times ear to shoulder back and forth. And you can feel that strain and pull. You should be going just to the point of a pull, not creating any pain. We're just trying to prove that range of motion. And the last one's going to be looking over each shoulder 10 times until you go as far as you can. Again, looking for that gentle pull, not pain.
Sure.
The next exercise is going to be what I like to call my patients sniff the pit. I feel like it's the best way to remind patients of how to do it, because sometimes they get a little confused when they're trying to remember this. So what you're going to do is you're trying to get the ear away from the shoulder, and you're going to use an overpressure of your hand. So you want your nose to go towards the armpit that is up in the air. So you're going to provide overpressure like this, And this is why we call it sniff the pit, because the nose is going towards the arm, or towards the armpit. But what you're gonna do with this arm is bring it around behind your back, and you're trying to lower that shoulder. So you can do that, or if you're sitting on a chair, you can grab onto the bottom of the chair, or if there's a back on the chair, you can reach across to the other side of the chair to hold it down.
I need to balance it.
Yes. And whenever you're doing stretches, you're gonna hold them for 20 to 30 seconds. Again, a gentle pull. You don't wanna create pain with that.
Sure.
And you can repeat that 2 or 3 times. The last one that we're gonna do is called the ice cream scoop.
Oh,
That's
I
what
don't know this.
call it,
I don't
at
know
least.
this one.
You do. That's just what I call it with my patients. And I like to use that because it's, when I think of scooping ice cream and you think of it curling up the ice cream, it's a suboccipital stretch. So to get those muscles that we were talking about in the back of the head, that when you're coming forward, you tend to tuck up and tighten them, we need to tuck that chin back in and then pull that head down. So that's why I'm calling it ice cream scoop, because you don't want to just pull your head forward. You want to kind of think of it as scooping and pulling the head down.
Makes sense.
And that way you'll feel the stretch right at the back of the head.
For sure.
Again, that's a stretch, so you're going to hold it for 20 to 30 seconds and repeat it 2 to 3 times.
Absolutely.
And those are the few exercises that I think are great to work on posture and loosening the neck that can help with neck pain and headaches.
Wonderful. So just think about what we're doing here is that we're creating motion, and anytime you create motion, ultimately what that does is draws more blood to an area, right? And so the more blood you get to an area, the better chance you have to heal. Good day and good health.